Thank you. Let me grab my pen now. Now, this is one of the exceedingly boring books I read over the weekend. I did, however, buy a book on freak shows, which looks fun. And if you need a blanket, just right there, and then grab one for me.
What does blanking it do?
Say what?
What does blanking it do?
It's on the tiny monitor right in front of you.
Wait, what does it do?
Say what?
What does it do?
It just blanks the screen if you need to turn it on.
Oh,
anytime.
Gotcha. Okay.
Give me 1 second.
That's my job.
Alright, whenever you're ready.
Yeah. Here?
Yeah. And then from the beginning.
Okay. You ready? Alright. So I think that health and time are a person's most valuable assets. Time you can't really control. You know, it's out of your power. You know, it just goes by. But health is something that's absolutely under your control. You can affect how your choices that makes you either healthy or not healthy. But the healthcare system in America may not be the most efficient, or may not be like as good as you thought it would be. You know, for America, it's full of inefficiencies and wasted money. So I think that the healthcare in America should be reformed. And I'm going to talk about how our healthcare system is compared to other countries, and the costs of our health insurance and healthcare system, and the people that are opposed to it, as well as in emergency situations, and then how our expensive healthcare can hurt us. All right. So, as a nation, we have a very strong sense of pride. USA, we're #1. But the truth is, in terms of healthcare, we're actually pretty far down the list. In the World Health Organization, which is a group of people, they make decisions for health-related issues in the United Nations, and they rated United States number 37. We are right under Costa Rica and above Slovenia and Cuba. When you think of those other countries, it's kind of like poverty, kind of, you know, not as well as America, but we're down there with them. So our cost per capita for health insurance is actually $7,000, and for Cuba, it's actually $251, and we're like right next to each other. So the spending and how much we're getting out of it isn't really proportionate. So our healthcare system might not be as great as we thought it would be, but here's a look at the costs. So for this graph, it takes average life expectancy over here and the price per capita spending over there. As you can see, United States, we are by far, we're like double everybody else in spending, but we're kind of on the low end for life expectancy. So our spending is not really going to good use. A lot of it's being wasted through inefficiencies. According to the Center of Disease Control and Prevention, we have about 50 million people per year that don't have health insurance at some point throughout the year. And you know, if you're in an accident, like a car accident, and you go into a hospital emergency room, you get a CT scan of your head, you know, your back, to make sure that nothing's broken. And if you don't have, but you have to get it. And if you don't have health insurance, you know, there's like horror stories that you hear of that like people being charged like $10,000, $13,000 just for a visit to the emergency room to get a scan. So the cost of health insurance is really high, and it's preventing us from, you know, getting the care we need. So let's look at why we haven't changed anything yet. Let's look at why, you know, it's still the way it is. So here's a little comic about Canadian healthcare, Canadian Universal Healthcare, and there's kind of like a little joke going around that it takes forever to get healthcare in Canada since it's universal, and it's not like, you know, funded privately, it's all government taxes and stuff. So here it says, look on the bright side, you're one spot closer, and you know, this guy that's sick is in a line that's really, really long. But in the movie Sicko, which is about healthcare in America. They actually went to the Canadian hospitals, and their wait minutes were, for emergencies, their wait minutes were like 6 minutes to 8 minutes, and it really wasn't that bad. It wasn't as bad as it's put out to be over here. So the things that people argue for against like a universal healthcare is that it raises our taxes. But if you think about it, if we don't have to pay for healthcare as much and raise our taxes, that would kind of balance it out since we'd be paying more for taxes. You know, everybody gets healthcare, but then we just don't have to pay when we go to hospitals. So it's paying differently, but everybody chips in and everybody gets rewards out of it. And there's also an argument that says profit motives help efficiency and help people, you know, care more and try more since it's for money. But you know, doctors that are treating patients that went through like 8 years of school, they already care enough about patients to, you know, not bullshit their career, you know, like their patients and stuff. So I don't think you know, sense of care is really a necessary issue. And the only one thing is that if we do have universal healthcare, our doctors will be paid a little less. And it's not by much, but I mean, my parents are doctors, and I hear them complaining about it all the time with Obamacare and stuff like that. But I mean, in the end, it's for the good of the whole country and for the community. You know, some people have to take and give a little bit. So, the views against healthcare reform aren't very strong, and let's look at the real impact of our expensive and inefficient healthcare. All right, so when you get in an accident, you know, like a heart attack or stroke or a car accident, you get shipped off the emergency room. They can't deny you any care because, you know, they're legally bound to treat you if it's an emergency. But in cases where it's like a minor emergency or something ambiguous where you don't know if you should go to the emergency room or not, so like, you know, you're feeling pain somewhere in your head or something might be wrong, but, you know, if you don't have health insurance or you don't have the money, you really don't want to go to the emergency room and spend $2,000 at minimum just to go see if anything's wrong, you know, in case there's nothing wrong with you. So that prevents a lot of people from going to the emergency room and maybe putting off something that could be really bad. All right, so, and the Institute of Medicine claimed that 18,000 people died because of no insurance last year and yearly. So our healthcare system compared to others is not as good as it seems. The cost is really high compared to what we get out of it. And for emergencies, we don't have a lot of options. And it all boils down to treating healthcare as a privilege versus a right, and I think it should be a right instead of a privilege. Thank you.
Let's see, right, you're up.